Welcome to Plan to Protect with Melodie Bissell, the safest podcast on the internet. I am Melodie Bissell, the president of Plan to Protect and the co-author of Plan to Protect the Manual, a protection manual for children and youth, and a protection manual for those that work with them. Amanda is off again this week. She has her wedding this week, but we are really honored to have Sara Austin join us today. Sara is the founder and CEO of Children First Canada, a not for profit based out of Calgary, Alberta. Welcome, Sara.
Hi, Melody. It's great to be here. Thank you so much.
I'm so glad you're joining me today for this timely topic. Before we get into this recent study that you were part of, Sara, tell us your journey leading you up to Children First Canada.
Well, it's a bit of a long story, so I'll just keep it short and sweet. I have dedicated my life to advocating for kids, to speaking up for kids, and most importantly, to empower kids to speak up for themselves. I've worked all across Asia, Africa, and Latin America with an organization called World Vision, leading their global child rights advocacy. I've worked in the United Nations in New York and Geneva, helping to pass international laws to protect the rights of kids. But in the midst of my global work, I really became aware that Canada was really lagging behind on the health and well-being of children. I was deeply concerned that Canada was falling far behind, and that I could really there was an opportunity to leverage some of my global expertise to make a difference for kids in Canada. And so that was really what led me to launch and establish Children First Canada.
Wow. So tell us what your mandate and mission is at Children First Canada.
Well, our bold and ambitious vision is to make Canada the best place in the world for kids to grow up. Many people think that Canada already is a world leading country. When we've polled the Canadians, they tend to rank us as the top 5 or top 10 country for children, when in fact we have fallen vastly far behind. In the past decade, Canada's fallen from being 12th amongst wealthy nations to being 30th. So we are far from being a world leading country for kids. And really our vision at Children First Canada is to bring together government with charitable sector, with the private sector, and with kids themselves, really bringing together all Canadians who care about the health and well-being of our children, to advocate for the rights of children and to really put children's issues on the radar. So our mandate really includes things like public policy influence, really trying to lobby our government, particularly at the federal level, to have an evidence-based policy framework for kids. We do a lot in the way of public awareness raising, really trying to bust the persistent myth of Canada being a world-leading country, and harnessing the data around what is true in the lives of kids across our country. We do research looking at what's happening in the lives of kids, what are the changes and trends year over year, and using that data to inform our advocacy. And then we also do a lot in the way of advocating directly with kids, empowering children with knowledge of their rights, and to be not only leaders of the future, but leaders today.
And I think Canada is committed to that for many years, but I know we've, fallen behind in even keeping up with our own commitment to this. And I just want to say thank you so much. My first grandchild is going to be born within the next 2 or 3 weeks. So I am so glad that there's people like you and Children First Canada who are advocating on behalf of our children. So thank you.
I appreciate that. I think every child deserves to have a champion, somebody who believes in them, who stands up for them, and who will never give up on them. Certainly, every kid deserves that in their family and in their school and in their community. But at a higher level, we need to be advocating for kids. And really, that's the vision that we have of Children First Canada, is to create a nation that really cares for our kids, and where we are informed and engaged and actively using the power and influence we have to make lives better for all 8 million kids in our country.
And that's certainly something we're really committed to doing ourselves. And that's why we exist, even as an organization. Now, I know you mentioned a few minutes ago regarding, what are the trends? And that probably leads us to the topic that we're going to really be focusing on today. And that is the recent study you did. If I'm correct, the study is called Raising Canada 2020. And this is the third annual study. Am I correct on that?
That's right.
Tell us about it.
Sure. So, as I said, this is third in a series of annual reports looking at the health and well-being of kids. One of the first things that I discovered when we were starting Children First was that there actually wasn't a go-to source for really looking at the state of childhood in Canada. There were reports on different issues, but really no sort of annual report card on the state of kids in our country. And so that was what inspired us to issue the Raising Canada report. We partnered with the University of Calgary, with the O'Brien Institute of Public Health to issue the first report in 2018, and it's now become taken on the life of its own. We work now with a number of research institutes, including Alberta Children's Hospital Research Institute and Stats Canada, working directly with the federal government to gather the key data of children federally and provincially, and to really provide that annual report card to look at the health and well-being of children, and to involve kids themselves. It's one thing for us as adults and researchers to look at this data, but this year, in particular, we've really harnessed the voices of children themselves to look at what's true in the lives of children, and to treat children as experts in their own lives. I spend all my time doing this kind of work, but even still, when I look at these reports, it's deeply disturbing. The statistics are pretty jarring, and it's really a wake-up call for Canada that the kids are not all right, and they deserve much better than they're currently getting. And we can and we should be doing much better for the sake of Canada's kids.
You're right. The statistics are really alarming. According to the study, it says 1/3 of children in Canada do not enjoy a safe and healthy childhood. 1 in 3 Canadians has experienced abuse before the age of 15. 1 in 5 children live in poverty. And suicide is now the leading cause of death for children between the ages of 10 and 14. That's really concerning. When I read that, even though we deal with it every day, and it's what we are trying to combat, just to see it as so current as 2020, just shows us how much more work we have to do. So, what were the 10 threats facing children? Tell us some of them.
Yeah, I mean, as I said, the statistics are quite jarring and disturbing. So the first threat is preventable injuries. They are the leading cause of death for all kids in Canada due to motor vehicle accidents, choking and drowning. And it's disturbing to think that kids are dying because of preventable causes, but also far too many kids being injured, and that impacts their health now, but for years to come. The second threat that we talked about was about poor mental health. And this probably is no surprise to any parent or grandparent or aunt and uncle in this country, because we know that children's mental health issues have been on the rise, and that poor mental health in particular is a growing concern for kids in our country. But one of the stats that was most alarming that you've mentioned is that suicide is now the leading cause of death for children ages 10 to 14. That one really hit home for me. I'm the mom of a 10-year-old boy. And so to think about my son and his friends and his peers, his classmates, this is the thing that really keeps me up at night, is worrying about the mental health of our children, knowing that far too many kids suffer in silence. They're often, their parents don't know. And some of the statistics we saw in this year's report is that there's a disconnect. Parents and kids are not on the same wavelength. Children have described their mental health much more poorly than their parents have. And so clearly there's a gap in communication or perception or understanding. And so one of the clear messages around children's mental health is that we as parents and grandparents, other caregivers, need to be really checking in on the mental health of our kids and ensuring that they have access to the supports that they need. Not surprisingly to you, child abuse is our third threat, knowing that 1/3 of kids in Canada experience abuse before the age of 16. And, certainly during the context of COVID-19, we've seen this be a very grave concern, with kids going off the radar for 6 months when schools closed, children being in lockdown in homes where for many kids home is not a safe place. And this has been a very grave concern.
I think some of the other threats that I read about also were around poverty and not having food security. And I think with so many children out of school, they didn't have access probably to lunch and breakfast clubs. Am I correct on that?
That's absolutely true. I mean, even before the pandemic, 1 in 5 kids were growing up in poverty, and so when the pandemic hit, and many parents lost their jobs and were really pushed to the brink, we saw a rise in homelessness, particularly for single moms and their children in cities like Toronto, but also, as you mentioned, a steep rise in issues around food insecurity and children not having access to the essential breakfast and lunch programs. I think what may be startling to most Canadians is that Canada's the only G7 country that does not have a national food nutrition program. So when you think about what does it take to become a world leading country for kids, this is one of the bare basics that every child needs to have a nutritious meal to start their day, and we know that that's simply not happening in many homes across the country because of poverty and many other factors. And with the pandemic, that's certainly become a much more grave concern and has to be a priority in this new school year as we move forward.
And I think in the midst of COVID and fighting a pandemic, we're just trying to survive ourselves. We're trying to tread water ourselves and keep our heads above water. And I know so for so many parents, they're trying to work, they're working from home, they're trying to manage homeschooling, caring for their children, sometimes caring for their elderly parents. So they're just barely trying to hold it together themselves and to provide that supervision where our eyes are on our children and remembering to sit down at the table and have a meal together. And, if you've lost your job and you don't have income, that's concerning. Thankfully, we do, I think, have a government that has provided tremendous supports to us in the midst of COVID, but I know that sometimes those supports don't always get down to the children and put the food on the table for the children or the
Yeah, there's
supervision.
That's right. I mean, there certainly have been some bold investments that have been made in the kids themselves, but what we're hearing from across the board, from children's hospitals to children's charities, is that it's simply not enough. The charitable sector at large is in jeopardy because of the huge hit that many charitable institutions have faced because of the impact to charitable giving right now, and the funding that's required to be able to provide after school programs or nutrition programs. So the whole host of supports that are really essential to kids' health and well-being are just not they're not adequate right now. And so we're as we look to the days ahead as the government prepares for the new throne speech and the parliamentary, we're really urging the federal government to put children first, to really make sure that kids are at the heart of Canada's economic recovery efforts. We know that when children thrive, all Canadians thrive, but when children suffer, our nation suffers. And so we really need to think about how kids have been impacted by this pandemic. And it's not just the obvious things like food security and abuse that we've talked about. It's other issues too. We saw a huge decline in children's physical activity. Barely 5% of kids have met the daily physical activity guidelines during the lockdown. In some ways, that's not surprising because kids were cut off from recreational programs and they weren't doing phys ed in school. But it's deeply disturbing to think about so many kids not having the physical activity they need, because not only do they need that for their physical health, it has such a huge impact on their mental health. Other issues that we saw in this report were around vaccines. There was up to a 20% drop in vaccination rates during the pandemic. And again, in some ways, that's not surprising because, of course, many parents were not taking their children to regular medical checkups. There was a lot more virtual care happening in recent months. But with everybody being worried with kids reentering schools and daycares around the spread of, we've kind of forgotten and lost a lot, sort of missed the mark when it comes to just the basic preventable vaccines like mumps and measles. And so it's really important with kids re-entering schools and daycares that vaccination schedules get up to date, because that's really core to the protection of children's health and the health of our whole community.
Well, that's important, especially when we are thinking about the days to come and what will happen when a vaccine is available to fight off COVID. I think to have parents be on top of that and even that knowledge is really key. Yeah.
Mm-hmm.
There's one other threat that I noticed, and it surprised me a little bit, and I'd love for you to speak to it. I think in light of everything that we've been dealing with in 2020 and the whole Black Lives Matter issue, one of the threats was around discrimination and anti-racism. Can you speak to that one?
Absolutely. We named systemic discrimination and racism as one of the top threats because even before the pandemic, we know that the odds were particularly stark for Black, Indigenous, and other racialized kids in Canada. And the statistics are really quite grave. They are much more likely to be growing up in poverty. They're more likely to be overrepresented in the child welfare system. They're much more likely to experience suspension or expulsion rates from school. And these are things that have a huge impact on children's physical and mental health, not only in childhood, but for their lifelong outcomes. And so when we think about our vision that we first Canada, making Canada the best place for kids to grow up, all 8 million kids in Canada, they're a quarter of our population. We know that that is not a possibility for Black, Indigenous, and other racialized children right now because of the impact of systemic discrimination and racism. It permeates all aspects of their life from birth through to adulthood. And so we really need to be thinking about the health and well-being of kids through the lens of systemic racism and how that's impacting the outcomes for children, and really to have a much more nuanced approach to how do we ensure that that kids who face these dark outcomes, that we confront that racism in the very early years, and that we not just put the not that we don't put the burden just on the parents of Black and Indigenous children. We all own that responsibility. That idea of Ubuntu, that African proverb, that we belong to each other, and it's everyone's responsibility to ensure that kids in Canada can survive and thrive. And really important part of that is confronting the racism that's so prevalent in our society.
Thankfully, children are so much better at this than I think adults are. We could learn so much from children when it comes to not looking at color. I heard this precious story about a mother and her child who were looking out the window, and the young son said to his mom, "Oh, Daddy just drove up." Now, Daddy is a UPS driver. And the son looked out the window with his mom and saw a UPS drive out in front of the house and stop. And the little boy got so excited that daddy was home and ran to the door. And he came back a few minutes later and he had a sad look on his face. And he said, "Oh, mommy, it's not daddy. This man has hair and daddy doesn't have hair." And the difference was this little boy was, a Caucasian child looking out the window, excited about his dad coming home. But the UPS driver that was coming to the door was an African American. And it was so precious to see that this little child didn't notice the color of the skin at all, but notice whether or not the dad had hair or not. And I just think we could learn so much from children when it comes to discrimination, anti-racism. They just don't see the color, they just value people. And if they do see the color, they love the color. And I think we can learn so much from kids.
I think you're right to being able to, I mean, sometimes to be able to see a life through the eyes of a child. And I think children have this innate sense of fairness and justice. I mean, any parent who's raised a child knows that kids are hardwired for fairness and justice. And when they see things that are not fair, when they see people being treated differently or in a way that's unjust, there's something that rises up in their core as a child to want to confront that. And I think one of the challenges that I've certainly heard from many parents during this pandemic, as we've seen the Black Lives Matter movement really rise, and really difficult things that are, headlines that are appearing in the news, and parents struggling with how to talk about racism with their children. I think one of the pieces of advice that I have for parents, grandparents, others who care for kids is that we need to get comfortable being uncomfortable and having hard conversations, and that it's okay not to have all the answers, and that it's okay to be learning with our children. I've certainly had many tough conversations with my son in recent months. We need to be learned together. For those of us who grew up not having learned about some of these issues in school, not having learned about the 60s scoop or the impact of residential schools on Indigenous peoples in Canada. And not just that this is something historical, but it's something that's still very prevalent today, and the impacts and the like of some of these issues, to be able to learn about these issues and talk openly with our children, our grandkids, and to learn together and to develop a new vocabulary together, I think is a powerful thing that we as adults can model for our children.
Sarah, did you find that the statistics were much different from last year, from this year? What impact has COVID had on your report?
Well, it's really clear that the health and well-being of children has been jeopardized by the pandemic. What we were worried about 6 months ago as the pandemic began is certainly proving to be true now. When we see the statistics 6 months in, all of the top 10 threats are either worsening or at risk of worsening because of the pandemic. And so issues like child abuse, for instance, with children being in lockdown, being cut off from trusted adults like teachers or coaches or others in their lives who would be normally the one to detect something was wrong. It's a harder story to tell, but in the sense that there was a drop in reports of child abuse during the pandemic because kids were off the radar. And so in some sense, if you looked at the initial data, it looked like child abuse had gone down, when in fact we know that isn't true. But now with kids re-entering school, re-entering daycares, we're seeing those numbers tick up. And what we're hearing loud and clear from child welfare agencies, child advocacy centers across the country is that child abuse has absolutely been prevalent, has been a very grave concern. But the kids are only just getting back on the radar now. And so this is something that we'll be watching for in the days and weeks ahead, is to see what truly happened in the past 6 months and how grave has it been. Other issues, of course, we talked about earlier were around poverty. We know that poverty has worsened during this pandemic because of so many parents losing their jobs and really being pushed to the brink, and how that's impacted housing and food security. So many of these things have been worsened and significantly impacted. And we need to think about this as not just being a 6 month sort of period of hardship for children. When children experience toxic stress in childhood because of abuse and poverty and discrimination, these other factors that cause adversity in childhood, that impacts them in a way that can shape their lifelong trajectory for health. Kids who experience adverse experiences in childhood are much more likely to experience chronic diseases like heart disease into adulthood. They're much more likely to experience mental health concerns, suicidal ideation, self-harm, addictions. These are things that are not just impacting kids, they're going to impact for their lifelong outcomes. And so it's really important, and the decisions we make now as parents, as policymakers, as people in our community that care about our kids, what we do now or what we don't do will shape the trajectory of a generation of children.
I often speak to the harm that can occur when a child has overexposure to cortisol, and how toxic that can be to the brain, and how it really does impact a child physically, mentally, in all areas. So I do think we need to take this so seriously. We can do so much better. Children First Canada does have a call to action. Our listeners, Sara, are church leaders, they're educators, they're early childhood educators, they're parents, they're community leaders. Tell us about your call to action. What can we do?
Well, thank you for that invitation. I think that, we, when we look at the statistics, I don't know about you, but I feel a bit overwhelmed by it all. It just feels really daunting. Like, what on earth are we going to do to make things better for our kids? But we've spoken with experts across the country, and there are three things that we've identified that would actually move the needle in a very rapid way on all fronts, on all top 10 threats to children. The first is the appointment of a federal commissioner for children and youth. It's an issue that's long been studied and investigated here in Canada, and it's a proven and best practice that's been used in more than 60 countries around the world. Actually, it's not rocket science, having somebody who's appointed with a mandate to make life better for children, and that they be independent, not be a minister that has political affiliation or a particular mandate for 4 years. We need to see somebody independent who will be the voice of children and to listen to children themselves, and to really hold our government accountable to moving the metrics for children's health and well-being. So that's the first thing. Secondly, we want to see a national strategy, actually having a plan of action. What gets measured gets done. And so we want to see a plan of action, a strategy that really tackles these top 10 threats, and being really dedicated to moving the needle on these issues urgently. And third, we want to see a children's budget, actually seeing money being invested in a way in kids. They represent a quarter of our population, They're 100% of our future. They deserve a fair share of federal resources. And so we want to see that money being, how it's being spent, where it's going, and being able to track that money that's actually going towards evidence-based solutions that will improve the lives of kids. So these are three very basic things that can actually really urgently move the needle. And in the children's budget, we really called for an investment of $250 million that will actually tackle these issues like mental health, child abuse, and some of the really other grave concerns that are impacting children right now. And where we're working with the leading experts across the country who have the capacity to hit the ground running, who are already doing that work, and who can do it much more effectively with the resources they need to be able to support kids.
So do we reach out to our MPs? What do you suggest we do with this, Sara?
Sure. You go to childrenfirstcanada.com. We have a call to action. It takes 30 seconds of your time. You sign your name, and it will issue a letter to our Prime Minister and to other members of Cabinet and members of Parliament, and really say it's a simple message that says you believe in the health and well-being of children and that you support these calls to action. We are all citizens who have a voice and who have something to say about these issues. I know Canadians care deeply about our kids. Yeah, kids can't vote, so they don't have a say in some of these decisions. But we as adults certainly have an opportunity to speak up and hold our Prime Minister and other members of Parliament accountable. I think sometimes in the faith community, particularly in churches, we tend to get a little bit uncomfortable sometimes when we think about advocacy and the role of politics. But we're citizens, and we, as people of faith, need to use our voices and hold our political leaders accountable to the promises that we make to our children. You said earlier, lots of plans and promises have been made to kids, and yet we see we're going in the wrong direction. We need to match those promises with actual tangible commitments, and to see better investments being made on the health and well-being of Canada's kids.
So we're going to put a link on the show notes to the podcast, to your website. And I know that there's two buttons that are really important on your website I want to draw people's attention to. One is that call to action, and there's another one that is a donate button. And Children First Canada is a not-for-profit, and I'm sure that Sara would also appreciate, and her team would appreciate, if we would give generously to Children First Canada to continue to help move this forward and make a difference. Is that right, Sara?
Thank you, Melodie. I appreciate that support. Yes, we do rely upon charitable giving, the generosity of Canadians to support this mission. We know Canadians care about their kids, and we would certainly appreciate your support and encourage your listeners, your viewers to make giving to children part of your regular way of contributing to society. We all give in our time and our talent, but to be able to give generously to support children's causes is a really important way that you can make a difference.
I know that particularly the statistics are stark for Black, Indigenous, and other racialized children. And I just want to speak to our audience here for a minute. I know we're trying to figure out, especially those of you who are part of the faith community, your children's programs are closed down, your numbers aren't returning to your churches, you're doing church online, but there's so many opportunities. These children are so much more likely to be exposed to adverse childhood experiences such as poverty and abuse, be overrepresented in child welfare and juvenile justice systems, and be suspended or expelled from school because of systemic racism and discrimination. I think this is a tremendous opportunity for faith communities across Canada, for community agencies across Canada to reach out and care for the marginalized, care for those that are oppressed, find opportunities to just give generously. As Sara already said, the charitable sector, they've seen a decrease in their donations. Though many of us have not been impacted financially because of COVID. Some people have, some of us haven't, especially because of some of the generosity of the government. This is an opportunity for us to give generously. So please do that, and please find ways that you, as a church, if you're a church, be the church and go out there and help these families that are in need, and find ways to be generous at a time like this. So, Sarah, beyond signing up and beyond like the call to action and sending a letter to our MP and giving generously, are there any other tangible things that you think the audience can do?
I think, we talked about this earlier, but really just checking in on the kids in your lives. I think what was clear from the data is that there's a gap between what kids are experiencing and what their parents think is happening. And there's no fault or blame around that. I'm a parent myself, and so I know what it's like to live through these difficult times and to feel like we're at our wits' end, to feel like we have nothing else to give. Um, and yet we know particularly when it comes to the mental health of our children, that every day, sometimes every hour and minute can matter in the life of a child and keeping them safe. And so to be checking in life and keeping those lines of communication open is so critical. And if you sense that there's a change in behavior, something that's not right, making sure that your child has access to the support. I think every parent wants the best for their child. And right now, even more so than ever, we need to really be checking in with the kids in our lives, making sure that they're doing okay. And if they're not, making sure that they're getting the support that they need to survive and thrive.
Last week on our podcast, Tori and I provided many, many very tangible ideas on caring for young people. And so many of those ideas can also be used for children. And similar to what Sarah just said, one of the examples we said is go out for walks with your children. Set aside a time every day at the end of the day. It's a great way to shut down your computer and say, okay, before we all grab a meal and turn on the television or turn on another screen, let's shut off the screens, let's shut off the news, let's go for a walk. And you'll find and discover so much from your children when you go for walks. That's when my children talk the most to me, is when we're out for a walk. And that combats a couple things, not only the ability to check in on them emotionally and how they're doing emotionally, but also gets you all out and provides physical exercise. So that's one tangible way. But last week we gave lots of ideas on tangible things you could do to really show care and check in on your kids.
Yeah, I think those very simple things, sometimes it can, as I said earlier, can feel really daunting and overwhelming. But sometimes when we boil it down to the basic things, are making sure that we eat meals together with our kids, as you said, going out for a walk and spending that quality time, because then we're nurturing our relationships and having those powerful connections, but also getting the physical activity that our kids and we as adults also need for our physical and mental health. When you take a look at the top 10 threats, there are lots of things that are within our control at a very personal level that we can do to improve the health and well-being of our kids. And then at a more collective level, being advocates for all the kids in our community. And really, we talk about it taking a village to raise a child, but I think it takes a nation to raise a nation. And so I'm really urging all Canadians who care about the health and well-being of kids to care not only about the kids in your immediate family, but how can we have that collective vision and care for all 8 million kids in our country.
I think another small way that we can do this is look at our bubbles. Take a look at your bubble and maybe readjust your bubble if you need to make sure that there's people within your family bubble that will also speak into the lives of your children and show care and concern for your children. And I think that's also just a way of just inviting a few more people into your bubble who really are committed to the care and the health and the wellness of your children. Any final words, Sarah?
Well, I think, I'm preaching to the choir here. I know that you and Melody and the members of your network all care about kids in your faith community. You're doing everything you can to protect children, to provide the training and resources that kids need to stay safe and well. But I think one word of encouragement here is, because we know that there's this persistent myth about what it's like to be a kid in Canada, that one very powerful, tangible thing you could do today is to tell somebody what you heard about the Raising Canada report. Click on our website, read the report, and then send it to somebody else and invite them to sign the call to action. We need to build this movement of Canadians who really believe in the health and well-being of kids and who speak up for all kids in our country. So that's one tangible thing you could do after listening to this podcast today.
I love this. Let's put Raising Canada 2020 report on the agenda of our staff meetings, our team meetings, our board meetings, and let's say, how does this impact our organization? I love that idea.
Mm.
Thank you. Well, we've come to the end of our podcast today. I just want to thank you so much. It's because we're doing this podcast at quite a distance. Sarah's in Alberta, Calgary, and I'm in Toronto. I just want to thank those of you who are listening for your patience, as some of our sound hasn't been perfect today. But it has been such a treat to have Sarah on today. So thank you, Sarah, so much for what you've done in 5 years with Children First Canada is remarkable. So thank you for that. Just what an honor to have you. This podcast today is sponsored by our Pocket Guide of Best Practices for Children. It's a great resource for frontline workers, filled with tips and best practices on creating a safe environment. The cost of those pocket guides, and it's a yellow one that is the one that is specifically for children, but those pocket guides are available on our store at plantoprotect.com. The cost is $8.99, or if you buy bundles of 10, they're $59.99 each. And you can also purchase those not only on our store, but also on Amazon and Chapters and probably your favorite bookstores. So I'd encourage you to get that pocket guide and give those out to any of the frontline workers that are working directly with children, as it really does have some of those best practices and knowing especially how to combat child abuse and also the health and safety and wellness of the children. With the podcast, what we always remind you to do is share. Please click and share this podcast with others so that other people can listen to it. Please click subscribe on YouTube so that you get notified every time that a new podcast is entered. You can even click that little bell button, which will send a notification out to you. We are going to include some show notes, which will have a link to Sarah's website and also to the Raising Canada 2020 study. So thank you again, Sarah, for joining us. I know it's early morning for you in Calgary, but thank you.
Thank you so much.
Bye, everyone.